Hi, Dr. Robert Selig, and again, thank you for watching my videos. In the last video, I was discussing how our hypothyroid conditions are a gut function, meaning that our immune system is 70 to 80% in our gut. So I want to give you some clinical pearls and gems on how to heal the gut. And this is just one of many strategies that I want to give to you. Today in this video, the clinical pearl and gem that I want to bring to you, which is an amazing therapy, it's called HCL Therapy, Hydrochloric Acid Therapy. This has been used very successfully in the 1920s and 30s in the pre-antibiotic era. It was pioneered by Walter Guy, MD, and Burr Ferguson, MD. They were actually World War I doctors in the trenches, and they saw some of the most horrendous infections that one could see, and who experienced some of the worst septic wounds ever, and they were getting remarkable therapies using HCL therapy by injecting HCL diluted into the wound with remarkable cures. So they were the pioneers. Hydrochloric acid injections stimulate phagocytosis. That phagocytosis turns on such as a macrophage to clean up the debris in the lymph. So all the dead cells in the lymph, when the lymph becomes stagnant, you need an active macrophage to get in there, to become the Pac-Man, to get in there and clean the junk up. Analysis of blood chemistries after diluted HCL injection showed increased levels of blood oxygen, increase in red blood cell and white blood cell counts, also increase in phagocytosis, which again helps remove the dead tissue and other debris. The carnivorous animals, on how the dogs, the lions, the tigers, the cats, they can eat some of the most maggot-infested meat and they can digest it without getting sick because they produce a lot more hydrochloric acid than we do, and they will render that infected piece of meat sterile. Pretty amazing when you just take that concept into your mind and understand the potential we have with using hydrochloric acid dealing with our gut infections. The common question would be, why are we so deficient in HCL production? And you know, the main reason is stress. The emotional stress, which I call sympathetic domination, that can render the parietal cells where HCL is produced in the stomach, that renders it basically inactive due to sympathetic domination that we call stress. This is what we call the emotional stressors. We also are going to have chemical stressors, a lack of postural integrity. Again, as we age and we start to degenerate, the head translates forward. We call that forward head carriage. And when that happens, that's going to encroach upon, again, the vagus nerve. When that vagus nerve is encroached upon, the signal to the parietal cells gets compromised, and again, lack of hydrochloric acid production. Age-related loss of hydrochloric acid. As we age, we hit our 4th decade of life, we start to lose HCL production. Also, we also have acid blocker therapies, which is, to me, an abomination in medicine because we're blocking our acid production with the Prilosec, the Zantex, the Nexiums, the Tums, the Rolade. That to me is a flagrant foul. You don't ever want to block your acid production. Now we need to understand a little bit about the chemistry of hydrochloric acid. The H in the HCl is the hydrogen ions. The hydrogen ions are the light speed button that turns your immune system on. The hydrogen ions make the macrophages aggressive. So when they become aggressive, they start cleaning up the debris. The chlorine part, the chloride, remember chlorinated pools, that's a disinfectant and like a scrubber of the debris. And so when you have the hydrogen and the chloride molecules cleaning up all the stagnant lymph and all the debris, you have a serious therapy on your hands to help deal with this chronic infection. We always want to understand how the pH works in the body. The stomach needs to be acid, the small intestine needs to be alkaline, and the large intestine needs to be more on the acid side. However, the intracellular space, the fluids between the cells, needs to be more on the alkaline side. This is why when we use hydrochloric acid therapy, it's imperative that we come in with an alkaline buffer such as potassium. We call that a activator. So HCl plus a potassium activator delivers a knockout punch to clean the debris in the lymph, in the intracellular fluid as well, while not causing the pH to get too disbalanced with hydrochloric acid therapy. We also need HCl for absorption of minerals. We know minerals are truly the key to life, and if we do not absorb the minerals, you will never have health. And the whole key to getting healthy is mineral absorption. And so hydrochloric acid, especially the calcium, also the iron, the zinc, the vitamin B12, and the proteins are all better absorbed when hydrochloric acid is functioning at an optimal level. Also, another key factor is HCl runs the pH of the stomach. And we need to be acidic in the stomach for mineral absorption, and it's big also with the whole ecology of the microbes in the gut. And again, understanding the pH in the microbes and how to fix the gut function with a simple time-tested therapy is one of those clinical pearls and gems that will help take your health to that next level in combination with other modalities. Again, thank you for watching my video, and I hope this brief introductory to hydrochloric acid therapy was helpful. Thank you.